I'm Dr. David Rubin from the University of Chicago Medicine. This is Best of the Day from the Advances in IBD meeting in Orlando, Florida. This is the first time this meeting has been in Orlando, Florida, but this is actually the 13th annual National Crohn's and Colitis Foundation of America meeting. We've had record attendance at this meeting of doctors, nurses, and industry persons, and we've been really excited about the meeting. This is also the end of IBD Awareness Week, which is the first week of December every year, and we've done a lot to try and raise awareness about IBD. I'm here now with my colleague and friend, Michelle Rubin, who is an advanced practice nurse at the University of Chicago in the section of colorectal surgery. She also chairs the Advanced Practice Nurse Committee at the University of Chicago and was on the planning committee for this Advances in IBD meeting. Welcome, Michelle.
Thank you, David.
So congratulations. A successful nurses meeting this year?
Yes, it was. We had around 160 to 170 nurses in attendance.
Amazing.
Yes, it was up more from last year. So it was very exciting, and we actually had a Canadian cohort of probably about 6 or 8 nurses from there that have joined us this year.
Oh, that's great. Well, we've certainly had our Canadian counterparts in gastroenterology at these meetings, and it's about time
they
brought their nurses.
Yes, isn't it about time?
That's
so
great.
That was very nice, and we had one from Denmark as well.
So going along with more attendance is also more programming, and you guys had your own symposium this year and expanded in some different ways, as well as some research posters that were presented. So let's start by talking about the symposium. What were the topics and who spoke at that?
So we changed the topic, or we changed the program a little bit this year. We decided to go with case studies and felt that we could sort of elicit audience participation, but also sort of bring it home to everybody and get more engagement in the process and feel like they could actually apply it into their practice. So we had 4 nurses from around different areas, and the topics were a medical case in IBD. We did a surgical case, a case on enterostomal nursing, and also on a pediatric case using enteral nutrition.
That sounds like a great symposium. So what are some of the topics that are of interest to the nurses who take care of these patients? They're such an integral role to our team, and I know our patients rely so heavily on them. What are the important topics that have been discussed, and what are some of the advances?
Well, some of the important topics for nursing really is looking at adherence again with patients. And I know this has been a topic we've talked about, over the last several years. But this year we were looking at beliefs, patient beliefs in their medication regimens, but also in taking these meds and the side effects. What do they believe, is cancer their overriding, side effect that they're concerned about? Or is it also the complexity of the medications as far as how often they have to take them? Is it IV or is it injection? Which fits the patient better? That's sometimes a concern. But also the number of medications that they're taking, and not only IBD medications, but on top of that, there are other medications they're taking.
Sure.
And then one of the concerns also was they feel that sometimes their physician is making them take all these medications, and it's just complex for them. So
the nurse obviously plays a critical role in all of this, and many nurses, if not most, have been trained to understand how to communicate some of this.
Yeah, so the main question kind of is, to check their adherence and what do they believe about their medications and treatment plan.
And what were some of the other topics in this symposium? You spoke about perianal disease?
Yes, I spoke on perianal disease in sort of use of cetons for surgical and medical management. So we know that combining the surgical and the medical approach is most effective for patient care. And I talked about the use of cetons, and I know that there's varying evidence out there of using the ceton for a few months and then removing it and maintaining medical management, or the cutting ceton. So I gave a little differentiation on both of those. Most institutions are using the cetons to leave them in, at least to get the abscess drained and let the inflammation subside and then maximize treatment. And once the inflammation has subsided, we can remove the ceton, maximize treatment and follow them.
Which is actually a change in the way we used to do it, right?
Yes,
because now that we have some more effective therapies, we have the option of potentially removing that, which is of interest to our patients.
Absolutely. Oh, definitely an interest, because leaving the ceton in, the first question they're saying, when can this come out?
Right.
And the other thing that's really important with using cetons is the perineal care. Doing the sitz baths multiple times during the day, or at least as much as they can, because they do have a job, but morning and then in the evening. Use of anal incontinent pads to wick away the drainage, because that drainage that sits there on their skin wears away at the tissue.
Sure. There was also a topic on pediatric nursing.
Yes. Use of enteral feeding, which if it's used, at least 80 to 100%, versus eating regular food, that the enteral feeding has a huge effect on, initiating remission, maintaining it, and preventing, flares as much as possible. One of the issues, obviously, is they have to put an enteral tube down, nasogastric tube down. And so that's a huge nursing education piece. And also, patients that when they, through their month and their illness, that whenever needed, they can put down a nasogastric tube and go back on feedings periodically. So, more persistent enteral feeding in the beginning, but then they can back off a little bit and use it when they need it. And that goes through college.
There was discussion in the pediatric part of the meeting as well about just understanding a little bit more about whether we should be using enteral feeding for certain kids.
Yes.
And that's a topic that's come up a lot, but now they started to tie it to understanding more about how the microbiome changes when we do that.
Right.
So maybe we'll have a better idea of what the mechanism is, so that we might use this either as a bridge to other options.
Absolutely.
Or at least start to figure out what's actually going on, so we can develop maybe better tolerated treatment strategies.
Right, exactly.
Was there any discussion about how much we have to deal with insurance companies to get approval for medications, and to think about all the stuff that goes on? Because I know that that's been taxing on the gastroenterologist's time, but a lot of that does end up falling on the nurse's desk. And we've been trying to shift that away, but it's a reality of the IBD world these days, and frankly in all of medicine. So what has been discussed among the nurses?
So yeah, that is a huge issue, and sometimes I know treatments are based on whatever we can get insurance coverage for. Yes, it does fall a lot on the nurses, and their feeling is it takes up a lot of their time, and really it shouldn't be a nursing issue, but we need to find other ways, whether it's other personnel that are dedicated just to getting insurance approval for these medications and treatments.
Right, because when you acknowledge all these other important roles the nurse has in the IBD team, dealing with the insurance and pre-approvals and reapprovals and peer-to-peer discussions is really not something that's a good use of those skilled team members, right?
Yes, and that is definitely an issue with nursing as well, is appropriate utilization of the roles, whether it's the advanced practice nurse role, the PA role, and then the RN role, and how we need to really optimize their levels in order to work effectively in practices.
I can imagine. There's been really an upsurge of advanced practice nurses in the IBD world.
Yes.
And I'm sure that you're enjoying that because you're a leader and one of the founders of that whole movement. What are the advanced practice nurses bringing to the table now, and what are some of the things they're doing?
Well, I think what they bring to the table is they still do a lot of education, and they spend, I think, more time with the patient than sometimes the physicians have. But we also reiterate, we discuss the risks and benefits of treatments, and we ask some of those belief questions, but we also get into the psychosocial issues as well, and sort of bring that to light, and then from there decide and hopefully reinforce with the patient that, maybe a psychiatric consult we need that, and is appropriate, and over time working with them. And the other thing is helping them, in their decisions of treatment, and giving them the benefits and expressing some of the risks. I think sort of an extension of what you explain to patients, and help to hopefully bring that down maybe to their level as much as we can.
Yeah.
But ask them, what do you think about this? How do you feel?
Well, I can tell you, and you know already, but our advanced practice nurses are independent practitioners who
Yes.
Can manage complex patients, but also know a great deal about how to do this in a good way, and that just adds to the way we can take care of patients.
Oh, absolutely. And I think that it allows the physician to spend the time with the patients that they need to when they need to, and then the nurse practitioners or PAs can help follow and manage the patients, of course, in collaboration with the physicians.
Well, when you start adding up that we're now doing vaccinations for these patients, we have to monitor them, and then you add the very important component that you brought up, psychosocial care, pain management, triaging patients who may need referral to a psychiatric or psychology specialist. There's just so much that we need to do, and we can't rely necessarily on primary care providers to be able to grasp all this and do that. And so having this kind of team is really important, not to mention all the other individuals like the nutritionist who's part of our team, and especially in pediatric practices, the social worker, et cetera.
Right.
So this is all really quite important.
It's, you know, I feel it really allows us better access for patients, you know, to care, because, you know, when the physician may not be available versus, you know, you're busy maybe scoping or whatever you're doing, but a patient needs to be seen maybe now, the nurse practitioner can get them in, expedite them being seen.
That's good.
You know?
One of the other nice things about this meeting that I especially noticed this year was how many people were able to display posters of original research and programs. And I know in the nursing program there was actually an award given to one of the nurses for her poster. Do you want to tell us about that?
Yes, that was Pam Morgan from Cincinnati. And she did a poster on transition of care. And it was looking at the patient, what they're looking for in this transition, what issues are important to them. It looked at the provider, what issues were important to them, and to the patient. And when they looked at all of these separately, there was not a lot of overlap. So the patient is looking more at, what can I do day to day? I want to go to work, or I want to attend school. Or younger kids, I want to go play, I want to be a normal kid. That's kind of what they're looking for. The physician obviously is looking for giving good care, keeping them, inducing remission, maintaining them in remission, mucosal healing, as we, our terminology we now use, that's where we want to target our treatments. And the family is looking at somewhat the adherence thing, but making sure that they're getting good quality care, that they're taking their medications, and they're doing what they're supposed to be doing, what they're told to do.
So I can imagine that understanding these different beliefs or goals can lead to much better communication of expectations, so that people are all on the same page when we come up with a treatment plan. So that sounds like a really important work that she did.
It is. And it's, you know, the nurse's role is to get those understandings, you know, to talk about it with the patient, with the family, and then with the provider.
That's great. The last topic I wanted to touch on was actually an initiative that you did as part of the National Scientific Advisory Committee this year, over the last couple years actually, and that's the nursing tips that you've been sending out. Can you share that with the audience at home so they can maybe see it or refer some of their colleagues to see it?
Oh, absolutely. It's on the ccfa.org website, and you go to for IBD nurses, and under there it's tips of the month. And our committee has worked on each month putting together a certain topic for taking care of IBD patients, that, you know, tips that we can use for patients and asking them questions, or just how to manage care. One thing, health and maintenance, and looking at vaccinations, which ones are important. And obviously the cornerstones, vaccination and health maintenance. The checklist is very important, that we've incorporated into that tips. But making sure that when these patients are first seen, that these are the questions that we need to ask them. The other thing is, in November, one of our tips was preparing for the holidays and how to eat for the holidays, also discussing the depression that can occur over this time frame, as well as in the month of December was obviously IBD Awareness Month, and you know, talking about patient advocacy and things that we can do to spread the word about IBD.
That's great. So for those at home, again, it's on the CCFA website, www.ccfa.org,
Yes.
in the For Nursing section.
For IBD
nurses.
nurses.
But you'll see that as a tab on the website,
yes.
right?
Right.
And of course, we also hope that everyone will help their nurses, their advanced practice nurses, their PAs, become members of the CCFA so that we can continue to grow the organization, right?
Absolutely. We definitely want to grow the organization, and with our growth will come more time that we get for the conference here as well.
Yeah, well, we are sure of that.
Yes.
So congratulations again on a very successful meeting, and we'll look forward to seeing even more next year.
Absolutely. Looking forward to it.
Good.
Thank you.
Well, thanks for joining us at Best of the Day from the Advances in IBD meeting here in Orlando, Florida. I've been with Michelle Rubin from the University of Chicago. We appreciate you being online with us, and we'll look forward to future updates at the next meeting.